Union leaders say they've reported Cardiff University to the Health and Safety Executive over claims of a mental health crisis among staff linked to planned job cuts. The University and College Union surveyed staff in March after job losses were announced in January. 197 responded, 78% of whom were at risk of redundancy, and there was a theme of stress, anxiety and depression. The number of jobs under threat at Cardiff University fell to 138 last month after changes to cost-saving plans and the voluntary departure of dozens of staff. Now, in response, Cardiff University said the survey and the comments made for difficult reading and that it had already been discussed by the University Executive Board. It's added, "We are listening and are committed to working in partnership with the trade unions on actions to address specific points, to improve well-being for all members of our community and to ensure we continue to provide timely communication." So let's discuss all this now then with Dr. Andy Williams, who's a senior lecturer at Cardiff University's School of Journalism, Media and Culture and a member of UCU. Morning.
Good morning, Dot. Thanks for having us.
And thanks for coming in then. Tell us about this staff survey and the results of it.
Well, it's really dark, grim reading for us. We got concerned in the midst of these, well-publicised and disastrous cuts that lots of our colleagues, lots of our members were coming to us with reporting serious problems. So we did this research and we found out, it was only open a couple of days, it was a rapid research survey really. We found out that 9 out of 10 respondents say that this kind of restructuring proposal called Academic Futures is negatively affecting their health and their well-being. 9 out of 10 are also saying the university isn't offering adequate well-being support for them. And it really made grim reading in the kind of qualitative results that we found as well. People reporting feeling suicidal ideation in many of the respondents. Pregnant colleagues saying that they feared for their babies, some even saying that they were even considering abortion because of the stress and the fear of the impacts of the stress on their unborn children. And this is really urgent, obviously. We took the findings of the survey to the university over a month ago, and despite what they say that in their statement today about them listening, they didn't offer any of the substantive remedies that we put on the table yet. So we felt forced to refer the findings to the HSE, and hopefully there'll be swift action from them, and that will push the university to some more substantial and meaningful responses. Listening is all very well, but we need to see action.
Well, the university, I read a section of the statement we've had from them. They say that support is available to all staff. They say the results of the survey, the comments make for difficult reading, that it has already been discussed by the university's executive board and a draft action plan has been developed at pace. Final plan's going to be confirmed, but that a number of actions are already in place, actually, including monthly meetings between management and trade unions, which are focusing entirely on well-being.
To be honest, the fact that it's been discussed at executive level in the university is news to the union, and we're really happy that that's the case. We anticipate really urgently and what's the word? We kind of would press them to come forward and talk to us about these proposals, these concrete proposals that they've indicated in their statement today, and to bring them to us, because what we've asked them to do is to take 400 people out of scope for redundancy. This kind of crisis is clearly linked to the redundancies situation. They've refused to do that. In a recent town hall meeting, staff were told that they would remain in scope, I quote, as long as it takes. Even more concerning, the Academic Futures plan presented to the University Council this week for agreement allows management to place staff in any school, not just those already slated for the cuts this year, to be taken in or out of scope at will, according to short-term fluctuations in student-staff ratios. So this kind of mental health crisis is going to become the new normal if council rubber stamps their academic futures proposals. That's really concerning.
Yeah, but the crisis reported in this survey, and you know this, life's complicated, isn't it? There can be many contributing factors to someone's struggles. Is it fair, do you think, to put it all down, the results of this survey, to the uncertainty around job cuts? Because people can have a lot going on outside work as well.
Yeah, of course. The workload-related mental health crisis that exists in academia in this country, in the UK and in Wales, is just a fact, right? We've been out on strike about that a number of times over the last few years. But when you have this kind of cruel, unnecessary, large-scale cuts plan imposed, and when it's done in the way that it has been done by Cardiff University, that is going to make things an awful lot worse. And you only need to look at the responses to the survey, the free text responses to the survey that we had, to see that our members are clearly linking this restructuring plan and these cuts proposals to their worsening mental health. And that's just worsening from an already terrible baseline. It's not. Yeah, in short, yes, you can clearly link this to the cuts proposals, and you know, if the university attempted to suggest that was otherwise, then we'd push back on that very seriously.
Dr. Andy